Hello, chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I'm Dr. Anthony Pellegrino from ChiroEdge. Welcome to the Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty to change your community from the inside out. We're going to be going over a couple different articles today. Number one, hypertension. Not morbidity and not quality of life, but actually mortality. How chiropractic is literally making less or helping less people die. Saving lives. For real. 2 case studies or a case series on failure to thrive, aka faltering growth, and case study on resolution of infertility, where we spend a little more time talking about mechanism and the emotional component than we do about the case study itself, but that's okay. Also, stick to the end, because at the end you're going to hear me on a quick little rant about what upsets me so much when we hear our friends talk about referral-based practices. As always, you can get this information, and by get this information, what I mean is that each of the studies that we review each week, if you're interested in them, what we do is we make this, the things we talk about in the podcast, there's about 60, 70 offices around the country right now that are downloading as we speak, as you listen rather, not as I'm speaking, but download this information on Monday morning when they come to their office in patient newsletter format. They come in, it has their logo, their information, everything like that. They're going to be coming in, and this week they're going to have handouts and corresponding social media posts, all with their branding on hypertension, on infertility, and on faltering growth. Every article that we've ever reviewed, there are these newsletters on. So if you want to look at getting a service like that, using not only this information to fire you up, to increase your certainty, but to literally change the hearts and minds of those in your community, in your office, to stimulate referrals, jump on a free trial at chiroedgemedia.com. Also, through the end of the month, as we mentioned on the last episode of the podcast, we still have the Amped Conference Special, because I loved it so much, going on through the end of the month, where you can get registered and signed up and get 50% off your first 3 months, which is a way better offer, at chiroedgemedia.com/amped, because we love and appreciate those folks so much. Anyway, let's go ahead and dive right into it. All right, I want to start off with a fun article this morning from the Annals of Vertebral Subluxation Research called Association of Hypertension Mortality Rates with Geographic Concentrations of Chiropractors and Medical Doctors in the U.S. in 2008 by Dr. John Hart from Spartanburg, South Carolina. And this is really cool, because what they did was they looked at the death rates for cardiovascular disease, not in like a double-blind randomized control trial, but what they did was they compared how many people died from cardiovascular disease in each area, depending on, and looked at basically the more chiropractors and the more medical doctors that there were in an area, is there statistical significance between how many people were dying of cardiovascular disease. They selected hypertension because there's some evidence that shows that a reduction in blood pressure in hypertensive patients occurs following chiropractic care. Now, in the introduction, one thing I wanted to bring up that was really sad was that approximately 2/3 of chiropractors in North America address a condition known as subluxation. Wow. 2/3 of chiropractors address subluxation. That's like, what? So only 2/3 of chiropractors are doing chiropractic? Oh, okay. Anyway, that's stupid. So they looked, and what they kind of talked about was that many studies have looked at the quality of life, and a lot of with chiropractic research, what we look at is the quality of life for individuals under chiropractic care. And what they actually found, what they were looking at here wasn't quality of life, but it was actual death. So it was not morbidity, it was mortality. When they looked at, this is just something that was really interesting to me, is they looked at different populations, or they looked at each different state. They went to the Federal Licensing Board of each chiropractic state. Looked for how many people were licensed and practicing in the state, and then divided it by their total, by the total population. And then that data was readily available for medical doctors. They didn't have to do anything special. But what they found was that in Alabama, for example, the total DC number was 784, which means that per 10,000 people in Alabama, per 10,000 people, there were 1.69 chiropractors. 1.69 chiropractors for 10,000 people. That means that if, like, every chiropractor saw, let's do a light still, grab a calculator. If every chiropractor saw 5,900 people a week, then everybody would be getting checked once a week. 5,900 on wellness care in Alabama. So when we talk about, well, high volume is dead, blah, 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 stop it. If you want to make a difference, you need to be serving more people. That's it. Okay. As compared to the MD ratio was 21.76. So that means that there were, divided by 1.69, 12.8 times more MDs than chiropractors in the state of Alabama. Wow. So they went and they looked at this, and they looked at the number of people who were dying from cardiovascular disease or hypertensive type issues every year. And what they found was, and this was absolutely just phenomenal, it's something to take with you today. That number, the 1.69 per 10,000, for every state, for every area where that number went up by 1. So for every one more chiropractor per 10,000 people, for every one more chiropractor per 10,000 people, one less person died of cardiovascular disease for that same amount of people. For every chiropractor that graduates, one less person is going to die of cardiovascular disease. So take that with you this week when you're going out there and making a difference. Just by simply you existing and putting out and changing the health of the people in your community, just by simply bringing awareness around healthy living and lifestyle and the fact that there's another way besides medication, just by simply you existing, lives are being saved. Now, if you're listening to this podcast, it means that you give a crap. So it means that you're doing more than just simply existing. So keep that with you. It's not just quality of life. You're literally saving lives. That's pretty awesome. All right, thanks. All right, this next article that I want to go over with you guys is called "The Chiropractor's Role in the Interdisciplinary Care of the Infant with Faltering Growth, 2 case reports." Now, this is from the Journal of Clinical Chiropractic Pediatrics. It was released in July. And we've been having a lot of really good case studies recently come out in chiropractic on things like faltering growth, which apparently is the new name for failure to thrive. As by the article, I hadn't heard that, but that's definitely something that I'm going to look into, because this is not something that I had heard. And what they basically do is, in the introduction, they go ahead and they review the reasons or the causes for faltering growth or failure to thrive. And it's pretty funny because it takes like 6 paragraphs for them to say, nobody knows what the heck's going on. So faltering growth may be caused by organic disease, such as celiac disease, urinary tract infection, renal failure, and cardiac abnormalities. And it says, however, that only accounts for a small percentage of infants. Previously, it was thought that it was strongly related to deprivation, but the theory has been recently challenged by several studies, concluding that there is no association between faltering growth and socioeconomic factors such as parental occupation, education, maternal eating restraint, and alcohol consumption during pregnancy. Researchers have attempted to identify risk factors for faltering growth, but evidence is either inconsistent or of low quality. Prematurity and neurodevelopmental concerns are likely to be related. There's inconsistent evidence for the association of maternal depression or anxiety. Moreover, faltering growth may be related to feeding difficulties, including weak sucking, slow feeding, consumption of normal quantities of milk, refusal of breast milk, and abnormal appetite. So basically what it's saying is that we thought that it's all of these things, and while these things may be present in many cases, it's definitely not an overall, let's just say, significant number, and that things that we have to look at is prematurity, neurodevelopmental issues, and then feeding, which obviously feeding makes sense. This kind of all sounds right up a chiropractic alley. So they review these two different cases. They go into a much deeper description in the first, so we're going to kind of hit the second one a little bit. We'll talk mostly to the first. So there's a 3-week-old boy who comes in. Mother is having severe breast soreness and slow weight gain. Breastfeeding was particularly difficult on the left side. Now, whenever I hear a parent say that breastfeeding is difficult on one side versus the other, I get really excited, and the way that it's easy for them to kind of understand with this is that, when babies have a subluxation, while an adult may really feel that and be able to say, ow, it hurts when I turn my head to the left or to the right, and obviously this is just to relate to people, the neck pain, etc. A baby is not going to be able to say, ow, mom, I can't turn my head to the right or to the left. I'm just not going to do it. And if we have to do that, right, during breastfeeding, it seems as though that will relate to an imbalance in wanting to feed on one side or the other, because if they don't want to turn their head to that side, they're just not going to do it. So a feed would take 45 minutes or longer at a frequency of once every 2 hours, so about 50% of this child's life was spent feeding and they were still underweight. They found hypertonicity of the upper cervical spine, upper thoracic spine, the masseter temporalis, superhyoid muscles. Over 4 weeks, what they did was, they did a few things. They did adjustments on the first rib in the spine, especially the upper cervical. They did some soft tissue work on the above mentioned muscles, and then some cranial work on the occiput as well. The interesting thing is that when they first started, breastfeeding actually got much more difficult. Right in the beginning, that 45 minutes actually went and boosted up to, it took about 2.5 hours to feed. So they kind of looked at changing some things, didn't really figure out what was going on, continued chiropractic care, and all of a sudden it actually went ahead and decreased. They went in and actually in the article they put a nice little curve of what their weight was over the course of the next couple weeks, and what they saw was that there was, from the beginning of chiropractic care, after that, and once they begin chiropractic care, you can really just see how the child weight really took off. So kind of reviewing this, that 13 weeks of age, fist sucking was noted in between feeds. At 22 weeks of age, he was having 200 to 240 milliliters 3 or 4 times a day. From there, in addition to weight gain improvement, night and daytime sleeping, breastfeeding difficulties and positional comfort were improving progressively and continuously over the course of care. At discharge at 22 weeks, a feed would take 20 to 30 minutes. In a cradle position, it could be resumed without any maternal discomfort or feeding difficulty. The infant was sleeping more hours in a day, as well as be able to sleep supine throughout the night. Being in the car seat was no longer a problem. They were developing well. They could crawl, roll over, bring his feet to his mouth. They felt confident about the baby's slow but steady weight gain for 14 weeks of age. But she continued weekly consultations with her MD until 22 weeks. At 9 weeks, they found a cyst in the head. But when they went to the pediatrician, they said that the child was healthy and thriving. At 23 weeks, there was no longer diagnosed as failure to thrive or faltering growth. At 16 months of age, they did a follow-up, and they found the child was right in the 75th to 91st percentile of weight, and he could walk, he could say his first words, and mom stopped breastfeeding at 9.5 months. They had a very similar case for case number 2, 8-week-old female, underweight, lots of pain, started getting adjusted, saw huge improvements in weight gain. Now, whether it's for the neurodevelopmental, digestive organs being able to better process, whether it's because the brain being able to better understand when we need to eat, whether it's because of improvements in latching or sucking or feeding or whatever it is, or being able to turn head to either side. The fact of the matter is that a better functioning nervous system, that the development of the spine is related to the growth and development of the human being, and that with a better functioning nervous system, through neurologically based or pediatric or subluxation oriented, whatever you want to call it, chiropractic care, the fact is that it will improve quality of life. It will, especially with things like faltering growth, because what that literally is that's a delayed growth and development, delayed quality of life, and what we want to do is help these children grow and develop into 100% of their best. Nice and easy case study for you guys with that today. Alright, for this last study we're going to be going over today, we're going to be talking about resolution of infertility following chiropractic care, a case study and review of the literature published in the Journal of Pediatric, Maternal, and Family Health by Dr. Riley Warren, Brack Burtis, and Joel Alcantara. Joel is a frequent flyer on the Chiropractic Research Breakdown, and Riley Warren is somebody that I actually graduated Chiropractic College of Life University from, so it's glad to hear that she's doing well. So reviewing, it's estimated that about 15% of couples, of people in our population is currently infertile. 15%. It's been estimated a lifetime prevalency of 26.4%. Now, the reason being, lifetime, why those numbers would be different, is because infertility in itself is diagnosed as being unable to conceive after 12 months, not years, 12 months of actively trying. So there's no blood work or anything like that that's specific to the actual diagnosis of infertility. It is just inability to conceive after 12 months of trying. So that's basically saying that 26% of people will have been diagnosed with infertility at some point in their life. It affects 7 million women. Of that 15% of people, of those that are unfertile, 40% of fertility problems are related to women, 30 to 40% to men, and 10 to 20% are unexplained. So common causes are sperm disorders, decreased ovarian reserve or ovulation dysfunction, tubal dysfunction, pelvic lesions, abnormal cervical mucus, and unidentified factors. The traditional medical approach is 3 things. The third in line is IVF, which is one we most think about, which is after the use of ovulation induction and laparoscopic ovarian surgery, although it may be suggested that older women may benefit from going with IVF. So this case report is of a 32-year-old woman who came into a chiropractic office. She had a lot of abdominal pain and sternal discomfort. It bothered her when she was bending at the waist, cleaning, carrying, coughing, cycling, driving, exercising. She had a pain that would last for 15 minutes. She was diagnosed with infertility or subfertile. She underwent in vitro fertilization for approximately 18 months prior to assist her in receiving. So she had done her in vitro for about 18, or she had gone through in vitro about 18 months earlier. She did get pregnant with twins at one point. However, one was terminated during her pregnancy, I believe, because of ectopic by some reading it later, and the other was remaining via cesarean section. So we're going to come back to why that might be important. In the abdominal area, assessment of the patient revealed acute inflammation of the peritoneal psoas myofascia result following an emergency C-section and ectopic pregnancy. After 6 weeks, the patient reported she was pregnant. They used activator arthrosym SOT, trigger point therapy in the upper cervical C1, C2, C4, C5, some thoracics, some lumbars. They were kind of all over the place, and she took standard process during this time. So, 6 weeks, pregnancy. It's a case study. It's a case study, but it makes sense for me. The reason that it makes sense, and really one of the reasons I said I was going to be coming back to the comment about losing the prior pregnancy, is that we, in chiropractic, in life, in science, are constantly mentioning that the nervous system controls and coordinates the function of every system in the entire body. You may have said that. You may have heard me say that I hope that you've heard that before. The brain and the nervous system control and coordinate the function of every system in the entire body, of every function in the entire body. That includes not only the physical functioning, the musculoskeletal, not only the chemical processing, but it handles processing emotional stresses as well, specifically via the limbic system. In times of extreme stress, if you look at the nervous system and look at it, there's a couple different arms. There's motor, there's sensory, and then autonomic. We're going to be focusing on autonomic nervous system here, which breaks up really into two different arms: your sympathetic nervous system, your parasympathetic nervous system. Sympathetic would be your fight or flight. Parasympathetic is your rest and digest and heal. So often, we keep and hold emotional stresses physically. I mean, that's the reason that when people get stressed, emotionally stressed, you can feel it in the top, they feel it their occipital area, they feel it at the top of their shoulders, and they feel it gets physically held, right? It gets physically held in the musculature. That's where it tightens up and everything that because of emotional stress. But the thing is that has to happen for a reason, right? That has to happen for a reason. Why do these areas go into spasm in terms of being able to handle emotional stress? Because emotion is emotion. I believe that is allowed to happen in the presence of subluxation, which is the reason I talk about interference going into the shoulders, and I say, you might often feel as though you hold your stress right there. Everybody's like, yeah. The thing is that if that's happening, whenever there is emotional trauma, that is going to put our body into a fight or flight situation in times of emotional trauma. I mean, it literally affects everything. I mean, if you just look at epigenetics, if we can look at previous studies, at old studies on Ashkenazi Jews, who is the reason they're great for a linealogical, I think that's how you say it, looking at like family history, is they're very good at keeping within their community, so the bloodlines of Ashkenazi Jews can be very, very pure and can be very much traced back. And they actually look at individuals who are Ashkenazi Jews who were victims of the Holocaust and who were not, and they found that actual genetic changes result in not only their ability to process emotional stress, but that the children and the grandchildren of Holocaust survivors are more likely to suffer from anxiety and depression. The grandchildren, because it's so stored within our body. So this woman, this 32-year-old woman, had gone through what I can only imagine is the most traumatic thing that a parent could experience, which is the loss of a child. And to have twins and to have that other one there, the other child there, it's like, what an amazing blessing, but it still is like a constant reminder, So I'm sure that she must be holding some of that trauma. I mean, it's not just stress, it's trauma with her each and every day of her entire life. There's still changes physically from the emergency C-section. She has constant reminders of both, I'm sure, as what I've heard other parents describe similar things as it is both the best and worst day of my life simultaneously. It's a father in my community whose wife was pregnant with triplets, and the twins were born and they lost one, and those are the words that I think were so impactful to me when he described it to me as that was both the best and worst of my day of my life simultaneously. She has this, and her body's storing this, and it goes into fight or flight, and it's being stored sympathetically, and the body's going to do whatever it takes to survive. So knowing the emotional trauma of going through this pregnancy, this labor, this birth, and seeing exactly what this was like, right, the body is going to be stuck. It's going to be stuck, and so the heart rate's going to come up, blood pressure is going to come up. It's not going to be in the environment in which fertility is not necessarily impossible, but is ideal. It's not going to be the ideal right position. When we look at chiropractic, physically, chemically, emotionally, so much of what we do is help people allow their bodies to better be able to process trauma. Now, a lot of us educate, mostly, a lot of us do, let's be real, on the physical trauma. Why? because it's the easiest to understand. If you go up to the random person on the street and say, hey, did you know that if you go to a very emotionally stressful situation, the bones of the spine are going to misalign and cause nerve interference, they're going to say, you're nuts. But if you tell them that if they text for 20 hours a week for 20 years that their structure of their neck is going to change, that's really easy to understand. Yeah, if you get in an accident, you have a whiplash injury, the structure of your neck is going to change. Yeah, we should fix that. Yeah, that makes sense. So a lot of us focus our education on that. But so much of what we actually do is help their body release and process previous emotional trauma that's stored in the limbic system. Psychologists, psychiatrists are recommending more and more, quote, body work, unquote, massage, chiropractic, physical therapy, exercise, yoga, etc., because the physical nature holds on to this emotional stress. Now, they're recommending this more as a therapy, right? Just like having this release, whereas we know that chiropractic is corrective, right? It's not just allowing the release, but we're correcting the structural changes, and by correcting something, we can make their body better able to process this long term. But I believe what happened in this woman was that her body had been stuck in this sympathetic fight or flight state for so long, and the chiropractic had simply allowed her body to remember and say, hey, you know what? I'm no longer in danger. Corrected the cause of the interference, corrected the bombardment of proprioception information coming from the upper cervical spine to the brain, to the frontal cortex, causing such a bombardment of information that the brain says, oh my gosh, I can't handle this anymore, I'm stuck. And by correcting and removing that bombardment of information, was finally able to go into rest and digest and heal. And 6 weeks later, this woman was able to get pregnant again, because her body was in a more fertile place, because it was no longer stuck in this fight or flight. Now we can take this and we can apply it to so much, to thyroid, to chronic sickness, to autoimmune disease, especially fibromyalgia, migraine, everything. But we just know that there's a reason that we don't just look and say, well, T12 nerves go to the stomach, let's just adjust T12. There's a reason that we do an assessment of the full nervous system, we deliver pinpoint specific care, because it's not just that there's pressure on the nerve that's going to the stomach, it's that the whole state of being, the whole state of physical, chemical, emotional nature of the body is distorted in the presence of subluxation. And that when we are pinpoint specific in correcting that, the body will heal. It will. All right? Keep that with you today. Go out there, slay some subluxations. Let people heal from whatever it is that's brought them to this moment, that's brought them to your office.
Real quick, I just wanted to get something off my chest here. There are few things that upset me more in this profession in my life than hearing somebody brag about the fact that they've had a referral-only practice. Few things, okay, for a few different reasons. First of all, I get it. Oh my gosh, I'm so, toot my own horn. I'm so amazing. I've run this big, whatever. If it's big, if it's not, it's successful to you, whatever. Practice simply from word of mouth because I do such an amazing job, blah, 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 blah. Great, right? Great. So here's the question. One of the things that I think about every single morning when I wake up and I go to the office is, what is my mission here on this earth? Now, I'm not going to lie to you guys. I truly believe as though, and you mean like you can have your own priorities or whatever it is. I personally truly believe as though my mission on this earth is to educate people about the ability that their body has to heal through neurologically based, philosophically based, principled chiropractic. I truly believe that's my mission, is to help people live a better life. I think that's the reason I was put on the earth. This is the reason I have this podcast at all, is because if I can help you understand the true potential of principled chiropractic, if I can give you additional certainty, then that will help you in turn go talk to your community and educate people to let them know what is achievable. And if I can not only serve through the four walls of my practice, if I can serve through the four walls of your practice, oh my gosh, that's even better. That's the reason I love aligning with organizations like AMP that have that exact same mission. So when I hear somebody say, I have a referral-only practice, it's like, dude, what is your mission? Or do that. What is your mission? Is your mission to do not really that much work and to see some people and help eradicate subluxation? Even if you've built a hugely profitable office, even if you see 500, 600 visits a week, or people a week, I don't care, right? Even if you see more people than me, I don't care. Because what could you be doing? What could your impact have done? Is your mission on this earth to toot your own horn about how awesome you are and about how you don't need to go out there and tell people about your services? Or is your mission on this earth to eradicate subluxation? What is it? Why do you wake up in the morning? And it just drives me completely insane to see these people who talk to other people about, oh my gosh, look at the benefits of me having my referral-only practice. Look how awesome this is. And it's like, how many lives could you have saved? How many people, how many kids could be growing up free from subluxation? How many kids could be growing up free from meds, right? Living their best life, growing and developing the way that their body was intended. I have somebody who I submitted a screening right now. This is a big screening for season for us. We have a lot of people coming up under their 1 year of anniversary under care in our office. And one of them the other day said to me, her husband started, then her family started after she saw. And there's no way I would have met them. We have literally no mutual contacts because they're new to the area. We just presented an answer for her husband, and she was like, yeah, so I get to come for the rest of my life, right? I just want to do this the same way I go to the gym. And it's if I didn't go out there in a screening, because she didn't really know anybody in the area, we're literally her family, her community. This is where they go and they know people to our practice. I mean, I could have sat back and let somebody maybe tell them. Or I could have sat back and had some jabroni come in and flying 7, the husband, not get adequate results, and then not have it become entire family care for the rest of their lives, letting their child, their daughter, their amazing, beautiful daughter, grow up to live the way that she was designed to. Or I could have sat back to my own horn about, we get so many referrals in referral-based practice. And I'm not going to lie to you guys, we get a ton of referrals. Okay? Or I can get off my butt, get out there, spend my weekend hours doing what I was on this earth to be placed to do, which is letting people know that the capacity for their body to heal is greater than any person would ever permit them to believe, because to be quite honest, there is way more money in sickness than there is in health. And I'm here doing you a favor by educating you about how well your body's designed to heal. Yes, I have no problem making money off of that. I mean, that's something that we had to really struggle with, because it's just because I am making money off this doesn't, when we were first and brand new and green in practice, I had this weird thought around that, because I felt as though, right, because I was making money, it seemed very self-serving to tell somebody. Until one day that switch kind of went off and I was like, no. I could be sitting at home twiddling my thumbs watching Game of Thrones right now and just letting the referrals stream in through the door. Or I can wake up on a Sunday and say, you know what, I'm going to stand out here in the heat on the off chance that I'm going to meet one person that is open to my message, that is open to changing their lives. So chances are, if you're listening to this podcast, you want to actually improve yourself, so you're probably not a referral-only practice, right? You don't go around tooting your horn and saying that. But if you are, I really want you to significantly take a look at that, introspectively look at that, and say, are you serving your soul purpose, or are you serving your ego? All right, that concludes another episode of the Chiropractic Research Breakdown. Once again, I was your host, Dr. Anthony Pellegrino from ChiroEdge. Please keep up with us at chiroedgemedia.com. If you got any value from this podcast, please go ahead,
subscribe, rate, review, and share. It is our mission to deliver the science and philosophy of neurologically based chiropractic to all the chiropractors out there who, like in this episode we mentioned, only about 2/3 of them are actually, what's the number 2/3? I don't remember, but it was a number. I have it right here. Yes, 2/3 of chiropractors in North America actually saying that they address subluxation. So it is my mission to get out there and change the hearts and minds of those who aren't, well, let's just say, educated enough to actually understand what the role of chiropractic is. Put this research in their hands. I will see you guys next week. Go out there and slay those subluxations.